mature conversation. So if you get the little kids, maybe put them maybe out in the backyard to play for a little bit. So we have Dr. Irwin Goldstein from San Diego Sexual Medicine, Alvarado Hospital.
Hey, Chrissy, how are you?
Just back. Hi, good to see you. Thank you for being here again.
Thank you
just
so
back
much.
from Washington, D.C. You were on a special panel with taking a stand for the women.
For women, yes.
For women.
This was historic. This was fabulous.
What happened?
So, in 1992, the government did a thing at the NIH for erectile dysfunction. And that was the first government recognition of a male sexual dysfunction.
1992?
That's a few days ago.
1992.
Yeah. That was the first time. But in 2014, for the first time ever, the government, through the FDA, did the first ever public forum on female sexual dysfunction. It was amazing.
And you were one of the main doctors.
So the second day they had a panel, and I was one of the invited panelists by the FDA, but we had San Diego patients, even some who have been on this TV show, with me on the first day, which was the patients discussing the problem with their sexual function.
The whole idea, Dr. Goldstein took a stand for women who have low sex drive. So, first of all, what is low sex drive? How do you know you have it? And what, if anything, is there to treat it at this point?
So, the typical woman with low sexual interest is someone who's actually had it in the past. So they know what it's like. It's wanting to do something.
Wanting to want?
Yeah, so it's wanting to want to be sexually active.
Okay.
As opposed to being responsive to the partner and sort of saying, okay, it's my duty, and you know, the usual response of women who have this low interest and are in a relationship and want to maintain the relationship is they sort of they create avoidance behaviors. They sort of go to sleep early, or they go to sleep after him, or they wake up early, or they do things to avoid. And it's very unhealthy to the relationship. Sure,
and maybe to the person, you know, individually. So, without getting into too many of the details, is there anything to treat that now for women? And is there anything down the line that you can see that may be happening?
So it's an unmet need. There's 12% of women in epidemiologic studies will say they have this condition of I have low interest. And they're bothered by it. There's a lot more who have it and are less bothered by it, but the ones who are moderately to severely bothered by it are 12%. That's like 15 million American women. They have many drugs for men. They have drugs for men with curved erections. They have drugs for men with erectile dysfunction. They have many of them. They have drugs for men who aren't interested.
But nothing for women.
Nothing for women.
Did you say that Viagra was okayed in 6 months? I thought these things took 20 years with the FDA.
6 months. And
6 months?
Just a few thousand patients, okay?
I'm in shock.
And with 6 months, with a year safety data. So they have drugs in the pipeline to be approved by the FDA that have 11,000 women in this study. They still won't approve them.
What is the problem?
They're gender biased. It's very obvious. And they claim they're not, but the evidence doesn't support that they're not.
Thank you for taking a stand for women.
Oh, it's my honor.
What's the next move? You got a clinical trial going?
So at San Diego Sexual Medicine, we have a huge clinical trial going. It's
just starting?
500 women. We're recruiting now for it. So if anyone out there in TV land has this condition of low sexual interest, you have to be before your menopause, so it's premenopausal women. Yeah, premenopausal women. You contact our office. The study is a 6-month trial, but if you're approved to be in the trial, it's a double-blind placebo control, so you could get a sugar pill. But the catch that we're trying to impress is the last 6 months, because it's a year-long study, is with open labels. You're guaranteed the drug. So that's a huge concept. This is a drug you actually inject into the
What is it?
It's called bremelanotide.
What is that?
It's called a melanocortin. That's its class.
Is it a protein?
It's protein, but what it does, it acts on the brain to dramatically increase the chemical called dopamine.
You mean the depression, happiness?
This is the happiness one.
Really?
It's a fabulous drug. Oh my gosh.
Well,
we've done the phase 2 trials already, and they're very positive. Really? Yeah, it's amazing.
How much so? What did you find out?
Well, it's an amazing drug. It lasts for 4 to 6 hours, and you're beside yourself. I have to tell you. It's pretty amazing.
What you do, man. This is great.
It's really cool.
So how do people, I mean, so you give yourself an injection once a day, or just whenever you feel like?
Prior to
whenever
your
you want
agreed upon event, when you want to want. Yeah.
Oh,
and then you want to want very, very well, and it could be that you don't have to inject forever. It could be that you learn this behavior.
Oh, I see. What else? What else?
So I have a patient that I just want to share with you. It's
Okay.
a fabulous success story, and I brought some tools with me.
Okay.
I'm going to make this really quick.
Paper cups.
So here's the testosterone, has the T, and testosterone acts on an enzyme called 5-alpha reductase. So the enzyme attaches to it, and it turns into this form of testosterone called dihydrotestosterone.
Oh, right,
So we had a woman come in with lifelong low sexual interest, okay? And she sees our sex therapist, our physical therapist, and myself in our coordinated approach.
That's a lot of work.
They're 4-hour visits in our office. But the bottom line was we gave her testosterone for her treatment, and it didn't work. And then we recorded the value of this dihydrotestosterone, and it didn't increase. So she had missing enzyme.
Yeah.
It's a genetic, biologic issue.
Oh,
so
genes.
in Europe, you can get dihydrotestosterone. It's a drug
can?
made in Cyprus. So
And
we got the
but
drug.
can you get it here?
Well, we got the drug for her. She administered it. She came back in 3 months, and all her sexual problems went away. She was
Dr.
now wanting to
Goldstein.
this was a fabulous
Man, it's people like you that make
opportunity.
this world go round. You make people happy.
Well, you're doing this is really appreciated.
It's my
not
pleasure.
everyone who wants to talk about this subject. and
Oh,
we
I love it. I
appreciate
think it's great. I mean, it's such a great thing. Thank you for taking a stand for women. I mean, it's something that I think
Well, thank you
gets
for
overlooked
putting this
quite a
on.
bit. Dr. Irwin Goldstein, if you want to be a part of this study, double-blind, placebo-controlled, which is a higher end,
Bremelanotide.
that's a when you're at that level of research, like he's getting to the higher level of getting this accomplished. So contact your office or just
Please.
go to our website, fox5sandiego.com, and click on the Scene On button.
Thank
That
you.
wraps it up for us. Erica, back over to you.
All right.